I chose to do my informative speech on STDs. The CDC states that exactly half of Americans will be infected with a sexually transmitted disease, also known as a STD. This is a sad but very true statistic, and people are faced daily with this truth. STDs are very preventable, yet men and women are diagnosed every day with one. Women are at much higher risk for cancers with certain STDs. I will start by talking about the different types of STDs, followed with signs and symptoms, and finishing with treatments and prevention. The CDC states that there are more than 25 different STDs. I will cover only the most common STDs, starting with genital warts, which are one of the main STDs that sexually active people will contract in America today. It is transferred through sexual contact. There is a 60% chance of getting genital warts from one sexual contact with an infected person, according to the eMedicine Health. Genital warts are a gray or flesh-colored growths found in the genital region and usually come and go in breakouts. They can cause cervical cancers, and the less breakouts you have, the higher chance for cervical cancer. Another common STD is genital herpes, which is a viral infection and cannot be cured. However, it can be treated for pain and outbreaks. It causes blisters and cracking of the skin near or on the genital region. The blisters look similar to what a cold sore on a lip would look like. Chlamydia is another STD that is common in America. According to the Mayo Clinic, chlamydia is the most prevalent STD in America today. Chlamydia is a bacterial infection and can be treated with antibiotics. Sometimes signs and symptoms are easy to overlook because they may never be present. If untreated, chlamydia can cause a person to become sterile, continuously get urinary tract infections. The major symptoms include painful urination, lower abdominal pain, discharge in both men and women, and painful intercourse. There are many STDs out there. Another common one is syphilis. Syphilis occurs in stages starting with primary syphilis, secondary syphilis, latent syphilis, tertiary or late syphilis, and congenital syphilis. Congenital syphilis occurs in babies, which is when the baby is infected either through the placenta or during birth. They can become deaf, blind, and also have teeth deformities. However, the most devastating STD to a person is HIV or AIDS. HIV and AIDS is an immunodeficiency disease. It attacks the body's immune system, killing off the much-needed white cells used to fight infections. HIV can last 10 years before becoming AIDS. As the virus continues to multiply and destroy immune cells, you may develop mild infections or chronic symptoms such as fever, fatigue, swollen lymph nodes, diarrhea, weight loss, cough, and shortness of breath. If you receive no treatment for your HIV infection, the disease typically progresses to AIDS in about 10 years. By the time AIDS develops, your immune system has been severely damaged, making you susceptible to opportunistic infections, which are diseases that wouldn't affect a person with a healthy immune system. The signs and symptoms of some of these infections may include soaking night sweats, shaking, chills, or fever higher than 100 degrees Fahrenheit for several weeks, cough and shortness of breath, chronic diarrhea, persistent white spots or unusual lesions on your tongue or in your mouth, headaches, persistent unexplained fatigue, blurred vision and distorted vision, weight loss, and skin rash. While there are medications for certain STDs, for others there is no treatment or cure, only medications to make outbreaks minimal and keep the virus under control for as long as possible. Genital warts are a virus that a person will have for the rest of their life, but there are certain medications a doctor will prescribe to keep outbreaks under control. As for genital herpes, there is no cure, but there are medications which will control outbreaks similar to genital warts. Chlamydia is a bacterial infection, so your doctor will prescribe antibiotics. Some antibiotics may be a one-time dose, as for others, you might have to take up to 10 days. After you're done with your antibiotics, the bacterial infection should be gone. This does not provide an immunity. You are able to get it again. As you know, syphilis occurs in stages. If caught in the early stages, it is easily treated, but it can be treated at all stages with penicillin, which is an antibiotic that kills syphilis organism. During your treatment, the doctor will want you to take periodic tests to make sure it's killing the syphilis organism. HIV and AIDS have different medications that blocks the virus in a different way. They are usually given in sets of 3 or more medications to prevent different strands of HIV being immune to certain medications. Doctors are only able to keep HIV from progressing into AIDS, which is what most patients die from. The best way to prevent yourself from contracting an STD is abstinence. The second best way is to always use a condom, and if you are sexually active, to get tested often and to keep yourself safe. and to get medication as needed for any STD that you may have.
She always gets her.
And